Hey, so tonight is a regularly scheduled video. In the video series I'm doing for Mental Health Awareness Month. So this one is about training on how to help those with disabilities during the treatment process in the mental health while they are in a mental health unit. So this could go a lot of different ways. One is a fidget, allowing them to have a comfort item, allowing them to talk to you about their disability and how it's affecting them and their mental health. Actually listening to them about wanting to switch or get off meds. Because people with disabilities so many times not really paid attention to by providers of in medical or mental health units. And that is very frustrating. I mean, I'm going through that right now. It's because you don't know what provider to tell something to. Because all of your providers know all the meds that you're on. And then you say, I'm having this trouble with that, like, this is what I'm experiencing. And they're like, oh, tell that to the neurologist or tell that to the psychiatrist or tell that to your therapist or your primary care. It should be one system where, like, if you tell one provider, they will automatically, like, talk to your other providers and keep them informed of what's going on instead of the patient having to make follow-up appointments post discharge. And that adds a lot of extra stress because there's a lot of appointments that you have to go to after you get discharged from a health unit for anyone, but especially for those with disabilities because they don't know who they can trust. They don't know if they would be believed or taken seriously or be dismissed. Talking about personal experience, even just recently, I felt dismissed so many times since September of last year by medical providers and mental health providers. Like, when I was discharged from the mental health unit in March, my outpatient psychiatric nurse practitioner, when I asked, like, and told her I wanted to come off of medications, she said no. She didn't ask why. She just automatically went no. So the providers on the unit need to be trained better on how to, like, so that kind of outside provider be dismissive to the patient. Like, especially since I brought up the same concern about the meds on the unit, and they didn't do anything on the unit either. If they had to stay in touch with my outpatient provider, um, my outpatient provider would have already been informed that I wouldn't be taken off of those meds. Although it happened on the unit was they lowered one of my antidepressants and up the other one. That didn't help me at all. And when a patient comes in saying that they see that they aren't supposed to have a particular med because of a medical condition they have, and you're like you don't like tell them to not worry about it, or you don't tell them that, oh, yeah, that's not very likely, or not tell them stuff like that, but be honest with them about the likelihood of that kind of happening, and explain to them in simple terms as like you're explaining to a kid, a child, an elementary school student, what they have, what meds they're taking, and why they're taking those meds, what they have been diagnosed with. So a lot of times we just get sent home like everybody else and not really understanding what's going on, like why we're on these meds, why the providers aren't paying attention to the medications and saying, or pharmacists saying, hey, these prescriptions should not be taken together because of this. That should not be up to the patient to figure out on their own and push to get meds changed or to be taken off. That's very, very frustrating as a patient in general, but especially a patient with disabilities who doesn't really know how to fully express themselves and explain what's going on with them. Especially for somebody that is a slow processing, like speed processes things slower, that is being said to them. And I've dealt with that even in school by teachers, by peers, but it is especially hard when it comes from professionally trained, like people trained in the mental health and medical professions. It should just be built into the training on how to handle people with disabilities better when they're in treatment in the hospital for treatment. They shouldn't have to feel like they have to repeat themselves over and over and over and over again. Because that stress to them that they already had, to stress that they already have because of their conditions, or anxiety or depression, whatever else that they might have. So that's maybe why you should bring somebody into the unit with disabilities to train the staff on what it's like to have disabilities and mental health issues. That's all for tonight. I will see you again tomorrow. Thanks. Bye.